Ed. And then also I was going to ask you about a rocking behavior in children. That's not real common, but when you see it, it's worrisome. Well, what's going on with that rocking behavior?
Well, there are a whole group of movements that are known as rhythmic movement disorder.
Okay,
in
there's
sleep.
the rocking.
That's right. Body rocking, head rolling, and head banging. Those are the three most common examples. They're very common in younger children and can persist into adolescence and rarely even into adulthood. They often begin in infancy.
Is there anything you can do about that?
Well, if the behavior is not causing any potential injury, we generally just educate the family and make sure that they are aware of what is going on. We try to protect the child from any type of injury.
I mean, if you're head banging, the little soft heads, that could be injurious.
Well, it could be. We generally start with things like making sure there's plenty of padding around the side rails in the crib.
Right.
In the older child who is already in a youth bed or a regular bed, if the child is banging the head repetitively against the headboard or the wall, we may move the bed out into the middle of the floor, take the headboard off, and so that there is less opportunity for the child to bang the head against a hard object. In more extreme situations, we sometimes will take much of the furniture out of the bedroom and just have the child sleeping on a mattress on the floor so that there's little or no opportunity to bang the head on anything that's a hard surface.
Because sometimes you just have to choose between what's going to be best for this little rocking child, and sometimes having all their furniture in the room is not on that list.
That's right.
And it's okay. So I hope moms out there are listening to this and are getting some kind of relief from it. Well, we've talked about two kinds of parasomnias. What are the two most common types of parasomnia?
Well, the non-REM parasomnias are by far the most common group, and within that, sleepwalking and sleep talking are probably the two most common. They're practically universal. I mean, who among us has not had some talking or walking at some point in their life? Now, the interesting thing about sleepwalking is we tend to think of just regular sleepwalking as being a sort of a nondescript, benign,
cartoonish-like thing.
That's right.
Seriously.
That's right. But in truth, sleepwalking can be much more active and can include some agitated features or even sleep running to the point that the individual is at risk for injury. We see patients quite often who have run into walls, door facings, who have tripped down stairs, who have run into glass sliding doors or windows. Obviously, if the individual walks or runs and gets outside the home or the apartment, they then are in a different environment, which can be quite dangerous.
Like the patient that was going into the forest during some of his sleepwalking.
Right. I've had more than one patient who lived near a wooded area, and they were actually sleepwalking or running into the forest. There are children and adolescents who have walked into traffic, have walked into unsafe areas, for example, a pool area, any type of an area that could be potentially dangerous would be of concern.
And that is the real value here, is to define these things so that parents know what's going on and know what the choices are that they have for either their child or for themselves, because we're not just talking about children. All right, let's talk about disorders of arousals, and we're talking sleepwalking, sleep talking. The newer ones, of course, they show all about sleep, about parasomnias on TV now. That's the big new topic. Sleep eating. Is it for real?
It absolutely is. That is a form of parasomnia.
Can a person drive while they're asleep?
Yes, absolutely.
Oh my gosh. Can they, what's the other one? Sleep eating, sleepwalking. Well, I'll have to come back to that later, but I guess that's pretty much enough.
Well, there are another shorthand way of thinking about this, that almost any movement or behavior that a person could exhibit during wakefulness, they can probably exhibit that movement or behavior during sleep. Now, they won't be fully awake, and their interactions...
They're not thinking. Just remember, they're not thinking. And that reminds me of the third one, which was being violent in sleep. This is the newest thing, and honestly, I look at those spouses and go, why are you still sleeping with them anyway? There's nothing wrong there. But that happens all the time, and so the violent, it comes along with sleep, walking, running. It's all the same group of behaviors.
Well, it may be. Now, fortunately, the vast majority of individuals with sleepwalking or sleep running do not become violent.
Yes.
The majority can be easily redirected back to their bed, and they return to sleep quickly and nothing comes of it. But there is a subgroup of individuals with sleepwalking and sleep running who actually escalate and become more agitated, particularly if they are approached by another person during the event. And so what might ordinarily be a very benign type of interaction, like grabbing the person's arm to redirect them back to bed, may actually escalate into aggressive fighting type behavior, lashing out, and things like that.
So what does that person do? The one who's watching all this happen to their spouse or whatever?
Well, of course, the first step would be to try to protect those around the individual, and typically a pattern has emerged in these individuals so that we are aware that they may have the propensity to fight or become agitated during sleep. And I have to say that that's the subgroup that particularly needs to be evaluated by a sleep specialist, because there's obviously significant risk to the person and those around him or her.
Well, how can you have a family life with all that going on? The kids don't know it, and well, it's a mess. So
it can be very worrisome.
Right. Okay, so we've gone, now what are the 3 Ps, the contributors to a parasomnia event? I have something called predisposing. What does that mean?
Yeah, I find that the 3 Ps are a good way of sort of helping conceptualize what tips an individual in favor of having a parasomnia.
Okay.
And so the precipitating factor is mainly genetics. We don't have specific genes identified yet, but we know that there is most definitely a genetic familial contribution to sleepwalking and many of the other parasomnias. And so it has to do with our basic makeup. Okay, so that represents a set of predisposing factors. The second P is precipitating factors. These are factors that may be present at certain times and not at others, but serve to tip the individual more in favor of a parasomnia. An example there would be an individual who has obstructive sleep apnea, and there's a breathing problem during sleep, and that arousal induced by the apnea then tips the person toward a parasomnia.
So, so you can have the 2 things at the same time, which again is just another reminder, do not take sleep apnea lightly. It has to do with many parts of sleep and health, and the parasomnia category is one of those.
That's correct.